Good afternoon, everyone. Thank you for joining us today for what animal care providers need to know about coronavirus. I'd like to welcome you to the webinar. My name is Carmen Rustenbeck, and I'm the founder and CEO of International Boarding and Pet Service Association. With us today is Annette Uda with Pet Therapy and Jessica Finnegan with Trinity Tower Consulting. And I'm so proud to have them both working with me today to present the latest news and techniques on how you could deal with coronavirus and what it really is. Also joining us today is Ben Day, Chief Operating Officer for IBPSA. And Ben will be fielding your questions to Annette and Jessica at the end of today's session. That reminds me of the question box, should be somewhere on your screen. Please type in your questions as you need to. For those IBPSA members, we will be recording this video and placing it in the member video library for you later today. And so without any further information from me, Annette and Jessica, welcome.
Good afternoon, Carmen. Thank you so much for having us.
Well, thank you, Carmen, very much. Good afternoon, everyone. We understand completely the crisis mode that we're in right now. We understand the fear that is just going rampant in our communities as well as our resorts. Our goal here for today is to educate and to provide some golden nuggets, some real life opportunities for you to bring peace of mind and control back into your resorts so that you can continue your business and provide a safety layer as best as possible for your staff, your clients, and your guests within your resort. So we are thrilled that you're here today. Please take the time as we go through this presentation and answer any questions that you have. You have a support system. The most important thing for you to know right now is that you're not alone. We are in this together, and we're going to help find solutions through this process and through this crisis together as a team. So Annette, I'm going to go ahead and give you the floor.
Okay, well, thank you very much. Okay, so first what I want to do is basically give you a little bit of background about myself. I actually am a manufacturer of ultraviolet germicidal radiation systems to help to disinfect air and surface facilities. We work with a team of scientists, whether it's Dr. Kowalski, who's a UV researcher, as well he works with the CDC, and he's an expert as far as hospital infection control. Dr. Robin James, who is also our chief veterinarian, and also Dr. Melissa Kennedy, who is with the University of Tennessee, who also works with biochemical diagnostic services. So what I want to do is talk about the breaking news that we found yesterday. So we did find out is that while there has been a lot of back and forth about how is this transmitted, what is the cause for this to be becoming so rampant, they did find that now, not only were they saying it was airborne, but now they're finding that it is becoming aerosolized and it can survive in the air. So we wanted to let you know that the latest report is showing that they're waiting for peer review, but it is showing that it becomes aerosolized. And we also are finding out that unfortunately the coronavirus patients may be infectious for a few weeks. IBPSA is going to have a resource page at the end of this where it's going to be at pettherapy.com/IBPSA. So be looking for those downloads as well. So let's just jump right into it. So we want to talk about what is the coronavirus. So you have to understand there's different types of coronavirus, and I know in this industry we've heard about it within our felines or our canines, but when it comes to this coronavirus within this industry, within the humans, we're finding that the symptoms can range between mild to severe, and it includes a fever, coughing, shortness of breath. And we talked about this becoming an airborne zoonotic disease. For those of you who don't know what zoonotic means, it just means it can transmit between animals to humans. Once it can go from an animal to a human, it is now called zoonotic. Things that you might be familiar with would be like your rabies, your ringworm, Giardia. So you just want to make sure that you're understanding the difference between zoonotic versus animal-to-animal transmission. So today it looks like it's the bats and pagnolas that are in the high suspected list of be able to create this. The other examples of airborne zoonotic coronaviruses that you've heard about before are like SARS, MERS that you might have heard in the past. So as animal care providers, as you know, you're in the heart of everything. And so people are coming to you and they're panicking. And I want you to be educated to understand how these diseases are originating and how they transmit, but also to be very much aware of them. The more you're aware of them, the more you can take control. But it's important to know that 6 out of 10 infectious disease and people are zoonotic. So every new emerging pathogen that seems to come out every year, 3 of them seem to have an animal origin, if you will. So we wanted to give you an update as far as, I'm sure you all have heard last night's news as far as where it's at and how far it's spread. Yesterday or day before yesterday called it a global pandemic. What they're finding now is that it's been over now in 125 countries and territories. We've accumulated or probably exceeded now as of today over 4,700 deaths, according to WHO. This one is interesting because we updated this at 8:45 on March 12th, and I'm in Illinois, but if you look at the numbers, even since last night, or 11, from 25 people, it's already grown to 35. So this is something that does spread quite quickly. So I just want to make you aware of where it's at currently. So what's important to know is how does it spread? So how can it spread and how can we protect our facilities? So again, we talked about how the studies are showing now that it's aerosolized versus airborne. I really want to explain the difference because I think this is where a lot of confusion comes in. So airborne transmission, what they've been referring to in the past is where you have a cough or a sneeze and they want you to have at least 6 feet between you and the person. That's because the larger droplets that are expelled will go to those distances and then fall to the ground. If you are within that range, the chances and likelihood of you being coughed or sneezed on, you can end up having it go directly into your lungs, or you can have it go directly into your eyes or any kind of open crevices to where you can become infected. So that's one reason that they've been really wanting everybody to be at arm's length from each other. The second and a critical thing to realize is there's aerosolized transmission. That means that the larger droplets from a cough or a sneeze will quickly evaporate in the air, and that becomes aerosolized, which means that those particles will attach onto dust and they will start to travel throughout your facility, waiting to be inhaled by another host, whether it's an animal or human. The COVID right now, they're more concerned about it being inhaled and being transmitted to another human. Fomites, for those of you who are not familiar, fomites just basically means that it's going to be particles or pathogens or whatever you may call it with sneezes. Those will fall onto the ground or onto the collars, leashes, toys, bowls, bedding. Those are things that are considered fomite. Currently, as we all know, there is no vaccination for COVID. They are working on it. They are still saying they're a little bit away from it, but we remember that with the canine influenza, right? The new strain that came out, it did take time, but eventually they were able to get the vaccine. So they are working diligently on this. So the important thing to know is people are asking is, can humans spread the coronavirus to their pets or vice versa? So there has been a report that a dog in Hong Kong was tested repeatedly to find out if they were positive for this new coronavirus, and the dog tested weak positive. Since then, we have not had any other reports of any other animals getting it transmitted to them by another human. And again, this is just the same thing we're talking. They just unanimously agree. The CDC is just stating that they don't believe it's going to be human to animal transmission. Now, again, anything's possible, so we want them to use precautions, but at this time, it's not a high risk problem right now. So the coronavirus. Again, I mentioned earlier, there's different strains about the coronaviruses. This coronavirus, even though it's zoonotic, does not mean that it's going to be transferring again between dogs and cats and cats. Those are different ones. Now you've got the coronavirus, the CE-CoV. That's known more of your canine respiratory or CRD. So that's going to be in that family. That's animal to animal transmission. This new coronavirus is zoonotic, whereas human to animal, or animal to human, pardon me. So as animal care providers, what is the best way to be able to protect your facility? So I'm going to jump in real quick because we did discuss how this is an aerosolized or an airborne problem, what we can do within our facilities to be able to try to minimize any kind of spread of this. So with indoor air quality, it's important to make sure that you're properly sizing air cleaning equipment so that you're able to ensure disease mitigation. It's so important for indoor air quality because, I guess I mentioned, if these pathogens are being expelled and they're aerosolized, they can go and wreak havoc throughout your entire building. So remember, the ventilation system are the lungs of your building. So you have to make sure that you're properly maintaining the system at this point. So real quick, I know we don't have time to properly size each and every facility with the proper amount of air cleaning, but we do have one solution at Pet Therapy. We work with ASHRAE. ASHRAE is the one who sets the standards for heating, refrigerating, air conditioning engineers. So they're the ones that work with mechanical engineers, with our HVAC teams. They are strongly recommending right now to get upper air units with UVGI. They also recommend in-room units, but at this time, again, we can address that a little bit later. But right now, for the immediate solution, I want to let you know that Pet Therapy does have upper air units, and we can help you to get through this crisis, and we have them in stock. So upper air room cleaning, it's going to be basically, we would want to put those units into hot spots, or if you will, like your isolation, your reception area, anywhere that's going to be more of a high risk environment. So people have asked me what it looks like. And so the UV upper air system that the ASHRAE is talking about is that you have the UV germicidal radiation that is going to be giving you 360 degrees. So if an animal is coughing, sneezing, panting, shedding, those pathogens and particles will by nature will rise up. With anything within that blue zone, you're going to see it's going to be an automatic kill rate. So we can definitely keep pathogen loads down. Again, we're not worried about the animals transmitting it, but if you have people who are touching the dogs and everything else, if they are going to be transmitting this, we want to make sure that even if they're coughing or sneezing, that we're able to kill these pathogens off instantly. So this will be able to do both. So as far as air cleaning and disinfection systems, I have been told numerously that people are knocking on doors saying, we have an air cleaning product for you and we want you to install it tomorrow. Folks, don't drink the Kool-Aid. We want to make sure that you're being protected, but we want to make sure you're being protected correctly. What is okay and appropriate for human health care is not necessarily okay for animal care. Why do I say that? Because right now there are products out there that are creating ozone, whether intentionally or not intentionally. That means that while it's not an ozone generator, there's products out there that will start to create ozone. A good reason for that would be kind of like your ionization, if you will. Ionizers, you need to understand the technology behind it. No matter how good the marketing is, you want to get past the truth of the marketing. So what it is that an ionizer will go and capture particles from the air, dust particles if you will. It will capture them, drop them to the ground. So it sounds great, right? Because you're getting it out of the air, you won't inhale it. The problem with animal care facilities is that the minute that you walk by or a dog starts shaking or anything happens, you're going to re-aerosolize those particles. And if you have those particles dropping to the ground, you are dropping them directly onto the dog. And again, while this is not a transmission between the animals at this point, you're still going to be interacting with those animals. So you don't want anything that's going to have the potential of re-aerosolizing and infecting the staff or any of their pet parents that may come through. So again, remember, these pathogens are not killed on contact. It takes a long period of time before those pathogens that are dropped from the air can actually die off. It can take anywhere from, I'd say, 15 minutes to 72 hours, depending on the pathogen. So again, I'm here for any questions. I just want to make sure that you're aware that there's very specific things you need to do for air cleaning. It's not a one size fits all. Same thing for UV. People are going to try to sell you UV systems. It's important to understand that UV has three components. You're using it for either water treatment, or you're using it for coil cleaning treatment in an HVAC system, or you're using it for air disinfection. All three of them are completely separate from one another. So make sure you're educated. Make sure you're asking the appropriate questions. My favorite question to ask all the time is, number one, where are your studies for animal care? And number two, do you have kill rates within 99% or greater within one air pass? There's a difference between knowing that UV can kill things on contact because it's touching it at 1 inch from each other. But there's a difference between asking if you're going to have a 99% kill rate in one air pass. So again, I'm here for any questions, but I just want to make sure that I'm making that clear. This is also very important. What we want to make sure is that while you do have other cleaning protocol in place, when it comes to the air exchanges, or the air, if you will, for a ventilation system, those of you who do have HVAC systems, you want to make sure that you're properly cleaning your vents and also your returns. And I would say I would have somebody be doing this at least in the morning when you are opening your doors. or at least at night when you're closing. You want to make sure that there's nothing blocking those vents either way. Also, when it comes to filters, change your filters regularly. If you didn't hear me, I'm going to say it again. Change your filters regularly. So these pathogens that are larger, that are considered airborne, that the CDC talked about, those pathogens are large enough to be trapped inside inside your filter. The problem is that they're not killing them. So if you're not changing your filters, those pathogens will flow right through them, or they're going to go around them, and it can make your facility sick. And it's going to block airflow, and that's something you don't want to do. Secondly, even your best filter out there, HVAC or your HEPA filters, if you will, they can only capture particles that are going to be 0.3 microns in size. So it's important to understand as well, it's going to be fantastic to grab the particles that are larger, that are airborne. Aerosolized particles that they just found out about are less than 1 micron in size. Filters, not even your best filter, will trap those particles. So again, you want to make sure that you're going to frequently be changing out those filters. You have to bring in an air cleaning system, as it's mentioned by Ashray. An upper air unit is great. The two combinations will help you very well protect against any kind of airborne transmission. I would like to make one last comment. So as far as the size of the filters, I've had people ask me, what is the Merv rating? So Merv rating just basically means that they're going to have different, I guess, more fibers that are going to be locked in together. There's more of an effective that they have. So you might have seen at the store, you may have like filters that are disposable filters, or you have ones that are going to be allergen filters. We don't want to get anything into our animal care facilities, and it's been recommended by our mechanical engineers in animal care not to exceed a Merv 8 filter. Now, do I say go under that? I'm going to say right now, as we're in crisis mode, make sure all of your filters are Merv 8 at this point. If you go over a Merv 8 rating, again, the tighter the weave, the more capture, which is true. The problem is the tighter the weave, the more the animals and the humans are coming through. Again, you want to make sure that you're not aerosolizing anything and you're not having it go through. But the tighter the weave, the more of the airflow blockage you have. And that means the more the hair from the animals can get into the filters of the dander. And you're going to be changing those filters. I can assure you, if you have a lot of animals in your facility, you'll be changing anything over a Merv 8 filter, or you should be, at least once a week. So stick with the Merv 8. That's my recommendations. And then that you could probably change out, depending on your facility size, either every 2 weeks or at least once a month, at least while we're in this mode. Once a month is minimum. Okay. So surface cleaning. Jessica, you ran a resort for years and you've been involved with this. Do you want to take this as far as cleaning procedures?
Sure, absolutely, absolutely. As Annette had mentioned, there is different levels of cleaning, and we have to address each and every one of them independently of each other. It's kind of, if you want to think about it, it's like I'm going to wash my right hand and I'm not going to wash my left hand. Are we doing the job and doing it justice? No, absolutely not. Is there an opportunity that that clean hand and that dirty hand will cross-contaminate and destroy all the work that we've done? Absolutely. So Annette has spent some time talking to you about air cleaning, which is critical. And I think as business owners, and I used to own and run a resort, we think surface. We don't quite give as much attention to air quality as necessary. And the coronavirus, in my opinion, has brought to light, oh my gosh, we need to start to think about air. We need to really start to think about washing our right hand as well as our left. So in support of what Annette was talking about, let's talk about surface cleaning. We have our protocols in place. Currently, I feel very confident that everybody that's listening to this right now has some kind of checklist, some type of product that you're using. And I'm certainly not here to promote one product over another cleaning product. What I'm here to talk to you about is re-looking at your physical protocols. You may feel very comfortable with the protocols that you have in place on a day-to-day normal basis. But when we go into a crisis mode and when we have a bump in the road, it's a wonderful opportunity for you to sit down with your team, your leadership, and re-look at your protocols. You may have, and in my facility, I always had my normal protocols and then my emergency protocols, in which The frequency changed. Who was able to dilute any cleaning solutions changed. My hands-on as an owner, as a leader, changed. So I first and foremost encourage you to please relook at them, and don't feel like you're alone in it. Bring your leadership team together and relook at it. When we're looking at the surfaces, we would think about floors, walls, ceilings. We don't think about things like windowsills. The windowsills, the top part of your cage unit. We think about cleaning the sides and the walls and the floors, but do we think about cleaning the top, that top layer where dust forms and cleaning solutions lay, and then all of those particles just sit there. And then when your ceiling fans come on, all of those particles are flipped back into the air for us to breathe in. So go and walk through your facility thinking, I know where I clean every day. Where am I not cleaning? Where are those coronavirus particles? Where are those air particles laying that I'm not addressing? And that's where you really get into your emergencies. Remember things like your leashes, any cloths, those bandanas, those adorable little bandanas that dogs come in with. All of those are carriers of this potential disease. So re-looking at those surface cleaning, establishing those cleaning procedures, emergency staff meetings to retrain and re-look at it. And then as we continue to tell you, it's really important that you communicate this to your clients. Your clients need to feel safe, they need to feel confident, and they need to have assurances from you that you're taking this seriously, and being able to communicate that information to them, that these are our cleaning protocols. We have now gone into our emergency protocols. We've met with the staff, our training. Our staff are trained in A, B, and C. We have certifications in A, B, and C. Brag about that. IBPSA, PAC, there are so many opportunities to gain those certifications throughout the year. And then we tuck them into our HR files, and internally we celebrate. This is the time, my friends, pull those certifications out and brag to your clients and to your community that we have elevated and we are prepared for this. We have been preparing for things like this for years, and here's our certifications. This is a really nice opportunity for you to create that confidence within your community that this is a safe place for their animals.
Yeah.
And that's
I was going to mention too, you had talked about bringing in, with the bandanas and everything else, and I think that's fantastic. What I was thinking about too is, because since this is not really where we're worried about animal to animal transmission at this point, we're more worried about the staff transmitting it, right? So would you suggest too, then, when we're talking about disinfecting, that now we're looking at maybe like your copiers, your office drawers, anywhere basically that humans are touching, right? So
absolutely.
Yeah.
Your hotbeds are going to be your lobby, your offices, your staff break rooms, your prep areas, and even so, your bathrooms. Oh my goodness gracious. You have to relook at, we think about the dogs and where the dogs are. Remember, the biggest culprits right now is human to human. So where do you have the biggest influx of human to human touch? And that's really where you need to relook at your protocols and your cleaning. The other thing that I would like to mention, and something that we had in our emergency protocols, which I think is nice, is I had slip leads in bulk in my facility. And normally when day campers would come in to drop off, we would just take mom and dad's leash and we would have it hanging with their name on it. And then when, Tommy's little mommy came back to get him, we would put the leash on and we would bring it up. Their leashes come from their homes, and we have no idea what's happening in their home. We have no idea the contamination that you are allowing to come into your building. So in part, I would suggest, as a golden nugget for you guys to hold on to, is get slip leads if you don't have them. They're controlled within your building and they stay within your building, and don't go home with your staff. And when the dog comes in for day camp, we talk about another solution as don't let clients come into your lobby at all costs. Keep people out. Have a concierge standing in your driveway welcoming clients. Hello, good morning. How are you? Lovely to see you. Concierge service. This is a drop-off service that we're doing. Open the door, slide one of your leashes or hand a leash over to the owner, slip lead, have them put that on the dog safely, take theirs off and keep it with them. You bring your slip lead out and you bring the dog in. So the owner never hits your lobby unless absolutely necessary. And anything that dog has on their body, their leashes, their bandanas, any of those fun little things, stay with mom and dad. You do not want any of that stuff cross-contaminating into your building. So it's simple solutions to a large problem.
Right. And that's perfect lead in too, because now we need to talk about more of the human to human contact, right? So like you mentioned, as far as the leashes, one thing I was going to mention, and not to get off topic, but in addition to that, personally, I would, if it were my facility, I would make sure that before my staff entered the building, I would be taking their temperature. I would want to make sure that they did not come in with low-grade fevers. At that point, I would send them home. So that's one thing about talking about human to human, because we want to avoid the close contact with people, as we talked about earlier, even if it's going to be within 5 to 6 feet. So we really want to try to get us away from, we want to get a little bit more distance between us. We are a very loving group, and whether it's going to be Fluffy or your friend that walked in the door, we just want to hug, and we have so much affection in this group and in this industry, and that's what I love about this industry. But right now, we really need to, instead of giving our high fives and hugs, let's give elbow hugs and kisses. We can just touch elbows right now. So I would just say that we want to get a little bit more contact or distance between ourselves. This is the hardest thing in the world, and I'm going to challenge you. I tried for 2 hours to see if I could just not touch my face. I went nuts because I thought that I could do it, but I couldn't. And we are so used to touching our eyes, nose, and mouth. So I'm going to say right now, since I can't do it, I'm just going to make sure I'm constantly sanitizing my hands. You just really want to do what you can to avoid touching those areas that infection can get into. No brainer. You're not feeling good, you're sick, stay home. That's something I would definitely tell your staff to be doing, and yourself as well. You don't want to be bringing anything in. Again, it's a very no-brainer, but when you cough or sneeze, try to cough and sneeze within a tissue, and then immediately throw that into the trash, and then you want to, again, wash your hands. I can't avoid that enough. So scrubbing. This is something I wanted to incorporate, because when we wash our hands, you can go in and we're always in a hurry, right? So we get the soap on, we wash our hands, we try to know we're supposed to sing a song within a minute, and then we run out the door. But if you're like me, you sing that song very fast because you have to move on to the next thing. Well, in this case, I'm going to ask you to please slow down, go into the bathroom, get your hand soap, wash your hands, scrub those nails, get the front, the back, and you want to do twist. Grab your fingers, start twisting your thumbs, twist every single finger, and then you want to rinse it off very well. I would do this repeatedly, especially if you're going to be handling animals quite a bit, because again, we're not worried about the animal-to-animal transmission as much, but if you have, like Jessica mentioned, they're coming from their home environment. We don't know where they've been. So we want to make sure that we're frequently making sure that we're cleaning and washing our hands. I will briefly want to mention about face masks. So the problem with face masks, and I know everybody's been panicking and buying them off the shelves, but the problem is that the face masks that we're buying, they're only really to prevent large droplets from expelling from us to be going into the environment. They are doing nothing for you if you are going to be having aerosolization, which that's what they're finding now. If that pathogen is going to be inhaled, it's going to get right through that mask. So the only thing that a mask can do is help viruses not go through the mask if you're sick, as far as if they're larger droplets. So again, for what it's worth, I really don't think it's really going to help to prevent anybody from getting sick. But that's, again, something that's been documented, and they've checked that out. So again, as hard as it is for us folks, and believe me, I'm right there with you, it's hard. I mean, we can't, as far as the animals, no licking, no kisses, no cuddles. For now. This is not long range, but just for now. So Jessica, maybe you can address this too. Like, what can they do to help their clients feel more reassured about not having any problems in their facility?
We have to understand, and we have to acknowledge the fact that we're not going to be able to completely mitigate the fear. But what we can do is we can minimize it. And as I had mentioned before, there's some real tangible things that you can do. Become better communicators on your social media. People are seeking, they've got time, they're staying home, they may be sick, or everyone is attentive to the news right now. So use your social media as a venue to continue to communicate with your clients. Safety tips, easy things for them to do. Provide them opportunities. What you're incorporating in your resort are things that they can do. Reminding them to clean their leashes, throw them into the washing machine and clean them. Give them helpful tips so that they begin to look at you, if they don't already, as an expert, as somebody that they can lean on and trust. The more radio silent you are, the more fear that they will have. The more panic that you induce and show, your emotions on your sleeve, the more panic they will become. So it's an opportunity for you to stop and breathe, organize and collaborate, and provide that information. You're going to be relooking at your protocols. Have an emergency protocol put into place. Communicate that with them. Let them know what you're doing. Let them know you're taking it seriously. Educate them. Annette has provided a lot of really important educational stuff about zoonotic and how it's transferred. Use these slides to help communicate information to your clients. They're seeing that you're taking webinars. They're seeing that you have certification, that you have spent this time talking to experts within the industry. Brag about that information. They will begin to lean on you for further information and updates. The more they can lean on us as experts, they will spend less time on Dr. Google and the crazy websites out there telling us to do crazy things that are just going to explode even more panic. So pull them into your fold where the information has integrity behind it, so that they spend less time out there surfing and finding information that's untrue. That's how you can do it. Your checklist, cheat sheets, communication, your protocols changing, that concierge service outside, that's a huge change to your clients, but communicate why you're doing that. It helps them understand you're not only protecting their pets, but you're protecting the staff and you're protecting them. You become the leader. You become the expert instead of just somebody else panicking out there. Annette?
Yeah, I was thinking about that, and it was ironic because if you remember the canine influenza, veterinarians were telling people to keep their dogs in the car, that they will come out to them and treat them because they didn't want to bring it into their buildings. Well, now we have the reverse. Now I agree with Jessica 100%. If you have the means, do the valet service. I mean, go out there and take the dog from the car, leave the parent in the car, and then you bring the dog in, because the one thing you don't want to do is be bringing more people into your building that you don't need to. So I thoroughly agree with that. So I think that would be a really good thing to do. So that's what I would do if it was my facility. So what I'd like to do is to summarize everything. Again, as we mentioned, we're going to be having a cheat sheet template because we understand there's not a one-size-fits-all facility. So Carmen will be providing that, and it will be uploaded so that you can get a copy of that for your facility. It's important to hang it on the wall because when you leave or you have a staff turnover time change, they can at least go through the checklist of what they need to be doing. For all of my pet therapy clients, currently, you receive a certificate to display showing that you are cleaning the air. That's important to make sure now that you do have that visible for everyone because it is now known to be an airborne problem. For those of you who have not changed your UV lamps and we've contacted you, please do so right now because it's important to know that that's what's going to be killing these pathogens on contact. If you decide that you want to go ahead and get an upper air unit from Pet Therapy, let us know. We can get it out to you right away, and we will as well send you a certificate so that you can have your pet parents rest assured to know that you're doing everything you can to protect your staff and also the animals in your care. Also, you want to let your clients know that you've attended this webinar. Like Jessica said, let people know that you're staying on top of the latest news. You want to let them know that you take these classes, you're taking certifications. You're not here to be just taking their dog and taking their money. You're here to protect those animals. And so I think it's very important that they're very much aware that you're doing that. Send out a newsletter, send out an email to let everybody know that. Just letting them know that you're staying on top of this and their needs. So also, if you've ever, like the Heroes for Healthy Pets, there's other infection control courses you may want to take. Pet Therapy does have an updated page called Viral News. We are going to be uploading our viral news about this PowerPoint presentation at the pettherapy.com/IBPSA. This is just one, but we try to keep that updated. Pet Therapy, as I mentioned in the beginning, we stay on top of any kind. We are exclusively working within the animal care industry. So we stay on top of any kind of new, existing, or emerging pathogens. So anytime you want any new information, or if you want updated information, please feel free to go to our website and we can be there to answer any questions for you. If you don't have the answers that you're looking for, feel free to give us a call. We're here for you. And at that's all I really have. Carmen, do you have any questions that maybe they might want to ask us? Or
we've got several questions, Annette and Jessica. If some of them are repeats, but if you'll bear with me, let me go through these, and you ladies take a shot at answering these. The first one is a best practice to stop non-essential stuff like suggestions for humans to stop elective surgeries such as doggy daycare for a while, bath, nails, etc. What to do with existing spring break boarders, though?
Okay, so if I'm hearing the question correctly, you're talking about elective surgeries?
Correct, elective surgeries, and also what do they do with the spring break boarders as far as bathing and doing the nails while they're in the facility?
So Jessica, you want to take that since you worked in a vet hospital and boarding?
Sure. Let's keep in mind, everyone, that we have talked about the transmission, and that dog to dog is not necessarily front of mind at this point, and it is opportunities, for example, like daycare, our day camp programs, and our social groups and things like that. I'm going to take a stab that you have outside facilities, that for the most part, you have some type of ventilation outside activities. There's really no reason to, as long as you're following your protocols and you're doing everything you're supposed to be doing, I don't see that there would be a reason why you would need to close your doors or close down your program, as long as you're taking all of the precautions and the steps that you're taking. As Annette said, making sure your staff are safe, checking those temperatures, communicating to your clients, avoiding access, extra people coming into your facilities that you don't need to. That your day camp programs, I would suggest, if you have the luxury of being outside, that you get outside. If your protocol says every 10 minutes and then we rotate, lengthen that. Change your protocols to increase the opportunities for air ventilation outside and less contact with each other. But as far as your bathing and your daycare, keep your protocols, maintain your emergency protocols, and keep talking about it. You're bathing, you're cleaning in between each and every single dog. You're not reusing the same towels or the same drying materials. Those are immediately getting cleaned. There's certain things that you could be doing, but I do not think that you should be shutting down your facility unless your facility is very unique and you can't find your way through the weeds, so to speak. You can't find the solutions within your problem. And that's when you should reach out independently to me or to Annette or IBPSA so that we can help you find the solutions.
Right. And I would address the fact too, as far as whether about surgeries, I would refer back to my veterinarian because they're staying on top of this as well as we are. So I would ask them what they feel is, if it should be held off or they should proceed with surgery. Also, if I can again talk about things that we don't think about that we're touching, such as our scissors and our, well, I always talk about that, but your nail clippers. So anything that you're going to be using before you go to the next dog, sanitize, sanitize, sanitize. Because remember, the dogs may not be transmitted between each other, but if your care provider that you have in your building may have the coronavirus, you want to make sure that they're not putting it onto the dog to bring home to their pet parents. So make sure you're constantly sanitizing in between.
All right, the next one's kind of long, so I'm going to kind of size it down just a little bit. The question is, should we cut off all non-essential stuff? It's seemingly that the answer was in the beginning, but I want to clarify that. Instead of the curbside pickup stuff, etc., I had flu last week, so did a manager. A staff member went home today sick. We only have a 7-member staff. Is it fair to ask them to go to the car and get a dog or be in our presence? This is getting worrisome for me. Could you please help me?
I think that we have to go back to the simple idea and get back to the basics. Let's take coronavirus off the plate. Let's rewind time. Several weeks ago, before this was even a discussion. Flu has been around for some time, and flu is just as worrisome to certain sectors of people. I think let's go back to our common sense. If somebody is sick, then they should be home. If they have a contagious disease, a contagious virus, they should be. Coronavirus doesn't change or mitigate that at all. So I would, you're going to have to make decisions. And it sounds like in this specific situation, it's a very small staff. And you may need to make alterations to your business. Before I closed my doors, I would change my staffing and I would change my numbers of animals. So if I had 2 staff members out and I only had 3 staff members that were sick and that were healthy and able to work, then I would change my protocols and I would put a limit that I can only bring in 10 dogs that day. I normally can bring in 40, but today I can only bring in 10. I would change things like that. Remember that it's not just black and white, but there's an entire row of gray in between that takes calm, thought out, collaborative, and creative out-of-the-box thinking. But in any case, I would tell you this in 6 months when coronavirus is not an issue. Don't let sick, contagious staff into your building. I think that's just, Annette, do you have any additional thoughts?
No, the only thing I think that one thing I forgot to mention is that, that's a good point. And believe me, when I was laughing, I wasn't laughing at the question. That was an awesome question. It was just a very powerful question because it's like, all right, what do I do in this case? So I agree. I think that I wouldn't be so quick to shut doors. I would probably minimize the number of animals coming in. One thing I would like to add to that, it may be a little bit off, but I was thinking that it's important to make sure too that when your staff leaves for the day, make sure that they change their clothes before they leave and don't touch anything out the door, because I think it's important for them to wash their clothes immediately when they get home. Because if these pathogens have fallen onto the person, you don't want them to be bringing it to their house as well. So again, Jessica, I think you bring up a good point. The thing is that there's more people. The flu has been affecting more people than the coronavirus has, right? The difference is that there's no vaccination for coronavirus, so it's scaring people and it's very, very contagious. So the important thing to do is just to make sure that we're using smart hand washings and do, like Jessica said, minimizing the staff if you can, where you can, from touching and everything else. But that's the only other information I'd probably add to that.
I think, and just supporting Annette, and just one additional thought that just came up is changing their clothes after they leave. When we're talking about the emergency protocols and how we change the emergency protocols, let's just talk realistic right now. I've been in many resorts across the United States as a consultant. And one thing I know is a fact, and it's unfortunate, but it's still a fact, is that staff do not clean their uniforms every day. They do not come in with a clean uniform when they report to work. That would be part of my emergency protocol, that would be an inspection piece when they walked in the door. That if I had extra uniforms in my facility, if I had that stock of brand new shirts, I'm handing them out free of charge. Because my protocol would be, when you walk into my building, you have street clothes on. You change immediately, and I'd have a changing area that was sanitized every single time. So they come in the back door, they go immediately into this particular bathroom, they change their clothes into uniform. It has been cleaned and it will be inspected by leadership. And then when they leave, they go back into that bathroom, change into street clothes again, and leave. Because if they change and they put their uniform on at home, they're bringing anything else in home. You may even consider having uniforms cleaned at the facility where you can ensure that everything just stays in-house. Over the next couple of weeks, you may think, I'm going to hire a cleaning service where all uniforms stay in-house, they're laundered and they're brought back. See if you can start to look at, out of the box thinking, I would rather spend extra money on cleaning processes and emergency protocol than shut my business down 100%. Does that make sense?
Absolutely. Jessica, this is a question of mine following up on your comment. Would you include shoes in those protocols for changing clothes?
Oh my goodness gracious, Ben, I think that's fantastic. And yes, absolutely. And there are in the medical industry, and I've worked in veterinary hospitals for many, many years as well as boarding. Anytime there was a contagious disease like parvo, there was bleach baths for our shoes. So that we would have to go in before we entered into the room. We would have, there would be little buckets. They almost kind of look like kitty litter trays, like buckets. And there would be a solution of bleach in there where you would have to put your shoes in there, step in it, and then you would have to go into a water, and then you'd have to go into a dry. There'd be a 3-step process before we entered and as we exited. So that could also be something that you do, because disease is carried on our shoes on a day-to-day basis. So Ben, yes, I think that's a great ad.
Okay. The next question is, for those of us with ceiling fans, should we use the fan in winter mode, pushing air up when using the upper air disinfection?
It doesn't matter. Either way is fine. Because as you've seen that picture, yeah, the upper air units, well, I can speak for Pet Therapy's upper air unit. It's a 360 degree kill rate. I mean, it's going to the entire room. So whether that fan is going up or down, it's going to actually kill the pathogens when it gets into that kill zone, if you will. So whatever you're comfortable with, up or down is fine.
What do you recommend for ductless AC systems for air cleaning?
Right now, because we're in urgent mode right now, I would definitely recommend the upper air units like the CDC is talking about. I would like to encourage everyone to call me so we can properly size your facility. We don't want to oversize you with UV and have it be something that you're paying more for than you need, but we absolutely cannot undersize you either. So we need to get a little bit more information, but it's a very quick questions and we can get you protected immediately.
Okay, the next one says, our business is caring for pets. Protecting staff is crucial, however. We may also need to be available to care for pets of people who are quarantined. Is this a valid concept?
Actually, if you don't mind me taking this, Jessica, it's absolutely okay to do that. The reason I'm saying this is because I reached out to the CDC. They're stating that if you're sick, it's better for somebody else to be caring for your pets. So again, you may want to, if you do know somebody is sick and they're bringing the dog into the environment, then I would probably have one staff member who would be responsible for bringing that dog into the building. And like Jessica said, take that leash, make sure you're keeping it separate from everyone else. I would probably at that point not let everybody see me, but I would probably put on a Tyvek suit or one of those, I guess they call it protective gear, if you will. I would bring gloves in and I would give that dog a bath really, really well. And then again, bring the dog into socialization, you should be fine.
And the only other add to that, Annette, is I would say if that family is looking for care for their animal, I would not offer them a daily day camp program, but a boarding program instead. And the reason why I say that is because you are just recontaminating every morning, every night, instead of saying, we will go ahead and bring your dog in for 14 days. Because once he's in and he's safe. But to recontaminate your staff in your building every single day would be, it would be more work than it was worth, I guess. That's something to consider, boarding versus daycare.
Next question is, what about a grand opening? Should I bother? Do the entire thing outdoors?
I think anytime you have a group of people, as we're seeing across the world, we are minimizing that. So if I was in a place where I could have it outside, I would feel much better. Again, to Annette's position, no shaking hands, no human contact, waving and things like that you can do. But you have a business that you're trying to open. And I also think that people are so panicked and so overwhelmed by these, the news and things. They need a break. Oh, having your open house outside and having some fun things outside that they can meet and greet may be it just may be something that they can get their mind off of the fear factor of the news, but you have to be diligent in your protocols. Annette, do you have a different feeling?
No, I agree with that because we don't want to stop living, right? And I think that we can make it. Well, it sounds horrible, so we can make it fun. But I mean, I have already gone to various facilities since this whole situation has started, and we just go in and, like I said, give elbow hugs and kisses. If nothing else, you're giving that arm spans, wet wait. You know what I mean? But I would still continue with life as normal as possible. We're aware of it. And they're not going to think it's weird that you're telling them to not shake hands or not to give hugs, or if you're, passing out hand sanitizers or things like that. So no, I agree. I don't know if I would it's going to depend on your area too. And I say that because perception is everything. So if you're having an open house and people are going to be not wanting to attend because of their fear, then I would probably want to delay my open house only because I would want as many people coming as possible. Now, if you're going to be in Phoenix or you're going to be areas where it's not prevalent, then to me, go for it. I would do it. What do you think, Jessica?
I agree. And be creative. Just be creative. If I was in a high zone area, I may still have an open house, but I'd have a virtual open house. I would use the money instead of getting popcorn and foosball tables and things like that. And I put the money into hiring a videographer, and I would have that virtual open house, tour them, take them through your facility that way and post it on your Facebook. Let them feel part and capitalize on the moment without having the risk of the physical people being there. So again, it's thinking outside the box and being creative. What you don't want to do is just shut down house, put the no vacancy sign on the outside, close the doors and turn the lights off, and just succumb to the panic.
I really like that idea, Jessica, because actually there was a client of both of ours that has an upper air unit, and they ended up making a video, and they're showing what they're doing to protect the facility. And I think if you put that on your website, it's going to calm a lot of fears. If people know that you're doing everything you can, from cleaning your hands to watching the staff to cleaning the air, I mean, all these things encompass, use that. Let them know, hey, we're on top of it.
Yeah. Right.
You may have addressed this one, ladies, a little bit, but I'm going to go ahead and read it anyway. The idea of having a staff member outside, a concierge for drop-off, this is something we will consider. Does your group of experts have any other ideas on how to utilize my staff's radios to minimize the risk associated with coronavirus?
Surface cleaning of those radios, the walkie-talkies. A lot of resorts these days are assigning walkies, so it's a 1-to-1 ratio. I get my own walkie, and no one else touches my walkie. And I know, my friends, that walkies are expensive. They're about $225 a piece, depending on the unit you get, and that's an investment. But small risk, small investment to avoid a bigger risk. If you are not in that position, then I would make sure that before and after they're sanitized going in and they're sanitized going out. And then your protocol being that they cannot, and there's no microphone, they can't put their face to any surface. And I would put that into my emergency protocol, that it has to be so far away from your face when you're speaking.
And I think that too should be part of your checklist. What I would recommend is have one person collect the walkie-talkies from everybody at the end of their shift, but I would have the person collecting the walkies to be wearing gloves and have them be the one to sanitize each one of those walkies before they put them into the dock to recharge for the night.
Yeah.
Perfect. This one says, I have a pet therapy system that we're very happy with. I am wondering if there's a way to disinfect the dogs before we get them. We do pickups and drop-offs. So if there's a way to wipe the dogs down so they do not come into our resort carrying droplets with corona.
The thing is that the pathogens that are falling onto the dogs, the airborne pathogens, that's going to be getting embedded into their furs. So the only way that I could suggest you do it is they do have what they call like an air machine, if you will, for like hospitals. If you want, I would just, that's a good question. I think as long as they're outside, walk them around a little bit. Let them shake everything off that they've had. Instead of taking them directly into the resort, have them walk around. Let them take a little bit of a break to be able to get those pathogens off of them. You actually, unless you're planning on bathing each and every one that comes through, I think that we just have to be smart. I would just say, again, let them walk around a little bit outside if you can, if the weather permits, and just let them shake it off as much as they possibly can.
Yeah. And then avoid any personal items. Everything stays
Right.
at home. Put a slip lead on them. You're just minimizing the amount of danger.
And that's what's going to be tough, right? Because people want to bring their own dogs' blankets or their toys. I think at this time, I would probably say, due to the increased, heightened awareness, we really want to refrain from bringing anything outside in.
Yeah.
Next question is, I'm in Canada and I'm wondering where we can buy a pet therapy system. At one time, the mobile system was available in Canada through Amazon.
Yeah, just give us a call. Again, the reason we've pulled it from being just an online purchase is because we have to properly size your facility. So please give me a call, 866-994-2473, and we will absolutely get the right recommendation for you and get it out to you.
The next one says, I'm confused. Didn't you say that the weak positive dog in HK means that it cannot be passed to dogs?
We don't know, right? So the reason that we're saying it can't be passed to dogs is because right now that's the information as we know. Everything has been changing with this coronavirus day to day. So that's why we're staying on top of it. Currently, the dog that has tested a weak positive has been the only one dog in Hong Kong. Since then, we have not had any more reports of human to dog transmission. So again, we're watching it, but at this point, we're not finding it to be a prevalent or even a reason for concern at this point. Now, again, that's why we've got our page about the viral news. If that should change at any point, we will let you know immediately. So that's why right now we just want to use as much precaution as we can. But that's all the information we have at this immediate moment.
Next question is, would it be illegal to ask our customers if they have traveled to an area with cases?
So no, when your emergency protocols, and again, we always recommend if you have a legal concern that you reach out to your attorney for legal advice and for your final word, what you would do with your company. But if this was my resort, what I would do is I would relook at my day camp and my boarding protocols and my rules. So dogs have to be, we put them in play all the time. Dogs have to be spayed or neutered by 6 months of age, and they have to have these vaccines and all of this information. We're not worried about HIPAA in these situations and things like that. So we are looking at our protocols. You at any time can change or add another stipulation to in order to take part in any of your services. So I would check with my attorney to make sure it was okay, but I think that you would be pretty clear to be able to add that line or add actually a few lines stating, due to the situation, any family member that has been out of the country in the last 30 days, they would not be open to any of our services here, or they would be limited services to only boarding and not daycare. However way you want to word that on your end, but I think as long as you change your protocol, you put it in writing and you communicate it, then at that point you have the ability to ask the question. I would, if my suggestion would be, is to put that wording together, send it over to your attorney to have them just look at it and check it off. But I feel pretty confident that your attorneys would be okay with that. Just double check.
Next question is, what would you do about training classes?
Any training classes that you can do outside, again, anything we can get outside, you want to get outside. I would limit anything that would be surface, like rethink about your agility equipment, your hula hoops, your balls, your teeter totters, things like that. You just want to make sure that anything that's surface is going to be at high risk. But your puppy classes, your intermediates, things like that, walking groups, I think you're totally fine as long as you're outside, or you have really good ventilation, or you have a pet therapy program, in your building. I would just stay cautious of those things.
Next question is, what to do about clients who are currently overseas and we have their dogs?
Well, just keep them overseas. You just stay right there. I think that I'm not quite sure what the question is do you just continue to, I would continue to offer the service of boarding. The dog is probably in the safest place it can be in your care. As Annette had mentioned, if you have a high risk potential of being contaminated, then they're asking that your dog not be with you. So I would continue to board them and provide that service. Otherwise, another family member can come pick up the dog, but I don't see any reason. If they're already overseas, then they're probably not going anywhere.
All right.
Next question is, what about if someone is sick and bring their dog to board? Even if they have no contact with us, what do we do with the dog? Do we decontaminate the dog?
I think that's already pretty much covered.
Yeah, I agree.
Yeah,
I agree.
So,
it's been
yeah, I would definitely walk them around if the weather permits, just to shake it off. And also, like I said, unless you're wanting to bathe them every time, there's not much you can do about it. Because even if it's the human influenza or if it's going to be this coronavirus, the likelihood of the dog transmitting it to humans just by them coughing or sneezing is not going to happen. I think at this point, we're just more concerned about the fur and the dander. So again, I would just try to get them to be in the sun if you can, let them shake a little bit before you bring them into the building. And if you want and you feel comfortable and you've got the means, then I would offer bathing, or I would just do it anyway.
Okay, ladies, last question. If we do not have an air cleaning system in place, should we close our facility to non-essential personnel? We are located in Sheraton, where at least one person has tested positive.
We can't make that decision for you. We can just tell you at this point that the CDC and also ASHRAE is recommending that the air needs to be cleaned, or I should put that back again. So the ASHRAE came out stating that you do need to have an air cleaning system. So even if you don't have a pet therapy system in place, there's something we can do in the meantime. If you're not comfortable, then that's a tough one, because the thing is that we know how it's transmitted now, right? We know it's aerosolized and we know it's airborne. So we have to make sure that we're being smart. If you're using all the protocols in place that we've talked about today, you should be definitely as safe as possible. If it's going to be, so that's really got to be your call. I would just hate to say, close your doors and you're losing revenue, but yet if you're not going to have the proper cleaning procedures in place, then I think at this point, I would do everything you can to ventilate the building as much as possible. So if you're talking about not having an HVAC system in place, then I'm assuming they must have roll-up doors. So if you can get like those big fans that can exhaust out air at the moment, windows, everything you can. The problem is that once disease is in a building, the likelihood of it coming out of a building just because you've rolled up the doors is very unlikely. So you're going to have to get that air moving. You're going to have to try to get the air to be purging from the building. I hope that answers the question.
I agree. I think that the point here is don't panic, stop, assess, gather your leaders, reach out to IBPSA, reach out to Annette or I and say, here's our unique situation. Here's what we have. If I put 10 resort owners in a room, I may recommend, as an expert, I may recommend closing 2 of them and keeping the rest open. The most wonderful thing about our industry is every single location is different.
Right.
Every single one is different. And when we try to cookie cutter things and try to put every resort into one little bucket, it's when we fail. So the blanket answer to everyone that's listening is don't be the mass chaos. Stop, assess your uniques, find your solution within yours. And if you have something specific, that's where we come in to reach out to us and say, here's our situation. What would you do in this situation? You've got a lot of experts in this industry that are here to help. Don't panic.
Okay, well, thank you, Annette. Thank you, Jessica. Ben, thank you for that long list of questions. You did that very well. Folks, we will have this video edited and placed in your hands within the next 24 hours. And we will also have that checklist cheat sheet for you to review for what is happening or what you need to consider as you're working through this time of emergency protocol and procedures. Again, I want to thank Annette and Jessica for being with us. You can see their contact information on the screen here, Annette at petarp.com, Jay Finnegan at trinitytowerconsulting.com. IBPSA, you know how to get a hold of us, info@ibpsa.com or CEO@ibpsa.com. We will try to get your questions answered that you submit to us professionally. And if we have to reach out to an industry expert, we'll let you know that we're doing that. I wish you all a safe weekend. There'll be more webinars coming up, more Facebooks coming up. Jessica has invited IBPSA members to participate in a Facebook she's putting on later this next few days. We'll be sending out that information. We have another webinar coming out on Wednesday that deals with HR insurance issues during this emergency time for your facility. We look forward to having you all there. Again, keep yourself safe, review those protocols. Please don't close your doors unless you absolutely have to. Reach out to one of us before you decide to make that decision, because that's a really difficult decision to make, and we want you all not to hurt yourselves financially. I wish you all a safe weekend. We look forward to spending more time with you in the future. Goodbye.